Welcome to the OHM BOCES Pre-K to Grade 12 COVID-19 Toolkit informational video. The information provided in this video will explain the toolkit, outline the steps necessary to safely come to work, discuss what to do if you have symptoms that could be an indication of infection with COVID-19 or if you have been exposed to an individual suspected to be infected with COVID-19, and the process to safely return to work afterwards. Our daily lives have been impacted by the pandemic, and as such, we need to be aware and diligent of our behaviors and interactions to limit the spread and ensure the safety of all students, staff, our families, and the community at large. Due to the fact that COVID-19 is a new pandemic that the world has not experienced prior to 2020, we are learning facts about the virus and preventative safety measures of how to contain the spread on a daily basis. The material contained in this video presentation offers the latest information for the New York State Department of Health and may be subject to change as new information from research about COVID-19 and safety precautions becomes available. The health and safety of all members of the school community during the COVID-19 pandemic depends on recognizing the importance of wearing a face covering whenever you are at school, practicing social distancing, and encouraging proper hand hygiene to limit the spread of germs. This toolkit was designed to be a reference that will address questions you and other members of the school community may have. The New York State Department of Health has updated the guidance for school staff, indicating that school staff are not considered essential employees. All staff, students, and visitors are required to take the daily COVID-19 health screening prior to entering any building. In this presentation, we will review the screening process and the process for when staff are allowed to enter the buildings and when they are required to stay home. During the COVID-19 pandemic, there has been a lot of new terminology which can be confusing. Two of the terms that come up most often are isolation and quarantine. What is the difference between isolation and quarantine? Isolation separates sick people with a contagious disease from people who are not sick. When someone is in isolation, that person must stay home and away from others. Quarantine, on the other hand, separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. If someone has been advised by the health department to quarantine, it is a requirement regardless if the person was precautionary reasons or mandatory reasons. During a quarantine, you may not leave your home or have visitors. As part of your daily health screenings, you are required to report if you are experiencing any signs or symptoms associated with COVID-19. When determining whether or not you are able to attend work in person, full transparency about your status is necessary to ensure the safety and security of your colleagues, students, their families, and the community at large. If within the past 10 days you have tested positive or you are awaiting the results of a COVID-19 diagnostic test, you must stay in isolation and away from others until you receive a negative test result, or the local health department has cleared you for return to work. Quarantine requirements can also apply to staff members who may not be experiencing any symptoms of COVID-19. This includes staff members who have traveled internationally or to states or territories on the New York State Travel Advisory List in the last 14 days, or those who have been designated as a contact of someone who has tested positive for COVID-19 by the local health department. If you answered yes to having traveled either internationally or to a state listed on the New York State Travel Advisory List on your daily health screening, you must quarantine for 14 days as staff members are not considered essential employees. This is important to keep in mind as we are entering the holiday season and traveling out of state to visit family or friends may become more common. Please be aware that if you are traveling to a flagged location as a personal choice and not as a requirement for work, you may not be eligible for paid time off during your quarantine. Any staff member who has been identified as coming into contact with an infected individual will also have to self-disclose this information on their daily health screening and will be required to quarantine at home until released by the local health department. In both scenarios, even if you receive a negative COVID-19 test result, you are still required to complete the 14-day quarantine. It is also your responsibility to request the order of quarantine from the health department, as well as a copy of the release from quarantine to provide to your supervisor before returning to work. If you have not done so already, familiarize yourself with the CDC-recognized list of symptoms for COVID-19. On your daily health screening, you will be asked if you have had, in the last 10 days, one or more of these new or worsening symptoms as shown on this slide. It is important to note the difference between new and worsening verbiage as it relates to your symptoms. If you indicate yes to any of these new or worsening symptoms, you cannot come to work today. Your first step should be to contact your healthcare provider to inform them of your symptoms to determine whether or not to conduct a COVID-19 diagnostic test. If you do not receive a COVID-19 diagnostic test or are not cleared to return to work by your healthcare provider, you are to remain home in isolation. If answering no to the questions on your daily health screening, you may return to work as usual, but remember to take the necessary precautions, such as wearing a face mask, practice physical distancing, and practicing good hand hygiene. As is the case with many illnesses, some symptoms can be more severe than others. If you begin to experience any of the following symptoms highlighted on this slide, whether at home or at work, it is recommended that you seek immediate medical care from your healthcare provider. The information presented on the following slides will address what happens when a staff member has symptoms and is unable to come to work. If the healthcare provider recommends a COVID-19 diagnostic test, you must stay out of work until you receive your test results. If your test results are negative, you may return to work if your symptoms are improving and are fever-free for at least 24 hours without the use of medicine. You must then provide a note from your healthcare provider indicating the COVID-19 diagnostic test was negative, or provide a copy of the negative COVID-19 test results to your supervisor. In the event that your COVID-19 diagnostic test result is positive, the local health department will contact you to quarantine. Once you are notified by the local health department to quarantine, you must report the information to your supervisor, who will then report this information to the COVID-19 liaison and begin to work with them to assist with their contact tracing efforts. You must provide your supervisor with the order of quarantine that you receive from the health department, as well as the release of quarantine. When notifying your supervisor that you have tested positive for COVID-19, please let your supervisor know when you were tested, where you were tested, if you are symptomatic, what types of COVID-19 symptoms are you experiencing, and when your symptoms began. After consulting with a medical professional, if your healthcare provider provides an alternate diagnosis, such as a chronic condition or strep throat, and COVID-19 is not suspected, you may return to work under the normal guidelines for your diagnosis. However, if you do not seek an evaluation or you do not complete the recommended COVID-19 diagnostic test, you must remain in isolation at home and you will not be able to return to work until your local health department has released you. Be sure to ask the health department for the release from quarantine form in addition to the order of quarantine. The local health department will be notified in all cases where a staff member who has COVID-like symptoms has not sought medical treatment or a COVID-19 diagnostic test is not confirmed, and contact tracing efforts will begin. The OHM BOCES Safety Office has gathered the following information for you regarding optional testing sites for completing the recommended COVID-19 diagnostic test. If you are unable to receive a test from your healthcare provider, there are multiple locations available within the community. Some testing locations may require a scheduled appointment, others will accept walk-ins, and depending on the facility, they may or may not charge you out of pocket for the cost of the test. It is recommended to check in with the facility regarding their policies, as well as your health insurance provider to determine whether or not the test would be covered and what, if any, costs you may incur. New York State has set up a free COVID-19 diagnostic testing site at Griffiths International Airport in Rome. Appointments for testing are required. Another option is WellNow Urgent Care Centers, which has locations in Utica, New Hartford, and Rome. They offer COVID-19 diagnostic testing for those who display symptoms or may have been exposed to COVID-19. Primary urgent care is another option for conducting a COVID-19 rapid test. However, if you are getting tested as a requirement for your return to work protocol, you will need to get prior authorization from your insurance company sent to the facility in advance of receiving your test. If the testing sites we've shared are not easily accessible to you, you can also refer to the New York State Health Department's website for finding location nearest you. New York State continues to expand testing for COVID-19 and is currently available at some pharmacies, urgent care facilities, local hospitals, and more. The role of the health department is to protect the school community during a public health crisis. Please be sure to answer your phone at all times in the event that the Department of Health must reach you for contact tracing purposes. If you require any additional assistance or have any further questions regarding the response to the COVID-19 pandemic, you can contact the Oneida County COVID-19 helpline at the number listed on this slide. As a reminder, if someone in your house gets sick, call your primary healthcare provider. Stay home if you are sick except to get medical care. Use a separate room and bathroom for sick household members. Wash hands regularly with soap and water for at least 20 seconds. If soap and water are not available, use hand sanitizer that contains at least 60% alcohol. Disinfect surfaces and objects in the home, such as doorknobs, tables, light switches, and remotes. Avoid sharing personal items like utensils, TV remotes, food, and drinks. And if at any point you develop emergency warning signs for COVID-19, call 911 and get medical attention immediately. This concludes our video presentation on the COVID-19 Toolkit for grades pre-K to grade 12. Thank you.